is 2:30. I think it's time for us certainly to begin. My name's Jim Anderson. I have the privilege of serving many of you and all the customers of the Springfield Area Chamber of Commerce, and certainly also the privilege this afternoon to welcome you to the John Q. Hammonds Enterprise Center, offices of the Chamber of Commerce. We are here today to celebrate an important development in the plan to improve health, education, and the economy in Missouri. It was just a couple of years ago that Cox Health and Mercy Health Systems in our community joined the University of Missouri School of Medicine in Columbia in announcing that they would pursue plans to develop a clinical campus in Springfield. Much of that careful planning has occurred with the support of this organization, our Health Commission, as well as other organizations in our region. Today, we're excited to share the results of a recently completed economic impact study for the clinical campus. We also will discuss this afternoon the investment that is needed to make this truly transformational project a reality for Southwest Missouri as well as our entire state. Let me highlight, if I could, the key finding from the economic impact study, and copies of which are available today for you. This plan to improve health by expanding medical education in Southwest Missouri would add more than $390 million annually to the state's economy and create 3,500 new jobs. Again, $390 million annually to the state's economy and create 3,500 new jobs. Certainly the Springfield Clinical Campus is one of the more attractive economic development projects for our state. We have as our guests this afternoon 5 most knowledgeable individuals, and they will speak to you in this order. Dr. Hal Williamson, and Hal is the Vice Chancellor for the University of Missouri Health System, to be followed by Dr. Bob Churchill, Dean of the MU School of Medicine. We also have with us Dr. David Barb, a graduate of MU's Medical School and Division President for Mercy Health System. Steve Edwards, President and CEO for Cox Health, is with us this afternoon, as well as John Swope, President and CEO of Mercy Springfield Communities. This time, let me introduce Dr. Williamson, who will come to the podium and share with us the history behind this partnership for creating the clinical campus. Hal?
Thanks, Jim. It's wonderful to see the great turnout from those of you who are here and excited about this project, and probably some of you who are here just because you're curious. Jim, I'm guessing that people sitting in the room, if somebody says Dr. Williamson is going to tell you about the history and you know he's an academic, you're now starting to look at your watch. My history will be very short, perhaps slightly revisionist, and certainly very short. Productive relationships between MU's School of Medicine and the very impressive health systems in Springfield have been going on for decades, literally, and I've been involved with them for almost 20 years. In the past, these limited but very effective relationships have increased the number of physicians in rural and underserved areas in Southwest Missouri and elsewhere in our state. In fact, since 2005, about 85 medical students have received some part of their training here in Southwest Missouri. Efforts like these have helped make MU the #1 provider of physicians for the state of Missouri, and we're very proud about that. About 3 years ago, leaders at MU School of Medicine, Cox Health System, and Mercy began conversations to see if these relationships could become the next step more productive. The concept of a clinical campus in Springfield was endorsed by the university, the Springfield community, and the 2 health systems, and we all agreed that it made a lot of sense. Nonetheless, due diligence was necessary, and it took us about 2 years to carefully study whether this could be a reality or not, and at the end of that time we concluded that it was doable. We thought that that partnership would increase the number of physicians in Southwest Missouri. It would be an asset to MU's mission to improve the health of Missourians, and we all agreed that it was feasible. We think that this work could be done. The data discussed by Mr. Anderson suggests that such a clinical campus would also have a very favorable economic impact on Springfield and the surrounding area, although that was not the principle where we began our negotiations. One of my jobs is to remind everybody that there's much work left to be done, however. The economic impact statement is in fact very impressive. Nonetheless, everybody in this room knows that a positive economic impact must be preceded by investments in capital and investments in operations. Medical education is expensive. Dr. Churchill can tell you that. He's in the middle of the throes of his making his budget for next year right now. The next phase of this work will need to focus on this important fact, that is that medical education is expensive. I'm very hopeful for this success because I'm confident that the teams that have been formed around this project have an aligned vision, that they are very determined, and that they're highly collaborative. And in that vein, I'd like to thank a few people, Dean Churchill, Dean Linda Hedrick, who is someplace here in the room, Mr. Weldon Webb in the room, Mr. President John Swope, and President Steve Edwards, and all of their staff who have worked very hard on this for the last couple of years. And you might imagine that there were many barriers to cross, and that group has done a great job, and my hat's off to them. Next, you're going to hear from Dr. Bob Churchill, the Dean of the School of Medicine. And Bob, come on up.
Thanks, Al. I'm not going to whine about the budget, so I'm going to try to just talk about positive things today. And let's go back to 1989. 1989, we got a new dean, Dr. Lester Bryant, who's a cardiac surgeon, who was previously the dean at Marshall University. And he arrived on the scene, and one of the first things he told the faculty, you guys have got a very good medical school curriculum, if we were still in the 1950s. He said, so what we're going to do is we're going to change the curriculum. And so it took about 4 years for a team to put together what the changes were going to be. And what we did was we selected a type of education called problem-based learning, or PBL. We weren't the first school in it, but we were one of the very first. And up until that time, we really academically really didn't have a lot to show in terms of how students performed on licensing examinations and everything else. And so this curriculum uses actual patients for cases for teaching and focuses on problem solving and critical thinking and lifelong learning. We think we're the only PBL medical school. There are not very many in the United States who actually have published all of our results over the years and who also actually test students for problem-based learning. And so we have a pretty good product now. Now I'm going to show you a graph here. So there's an examination that every medical student in the United States has to take in order to get a license to practice in any state in the union. And there are 3 steps to these. This is our step 2 scores, but our step 1 scores actually are more dramatic. And you can see before PBL, I always say, we were at the national average. The fact is, our average scores were never above the national average. It'd be a rare year for us. And so since PBL, I think you can see, and I think we have information around here, we are way above the national average every single year and continuing to rise. And so this is a very important thing because these scores actually determine what kind of a residency program our students match into. Program directors look very hard at board scores. So then it's a fair question. Well, okay, so now we know these kids are really smart and perform well on tests, but how are they as physicians? Well, one of the things that we also do as part of this curriculum change is that we survey all the program directors in the United States that take our students into residency programs. They consistently are ranked in the top 10 to 15% of all of their residents. We also hear anecdotal stories from other hospitals in the United States. I'm not going to mention their names, but if I did, you'd all recognize these as the top places in the country. And they all have the same story. We love getting students from the University of Missouri into our residency programs because not only are they smart, but they know how to do things. They know how to practice medicine. And believe it or not, most medical schools really can't claim that. There is one really famous place in the country, and I'm not going to tell you who it is again, that in one of their residency programs, they have had more chief residents in that residency program than any other medical school in the United States, including their own. So we really have top students, and those are the kind of students that are going to be part of the clinical campus down here in Springfield. And our students really make an impact on the community. Our students are involved in influenza vaccination in the public schools. They work in women's shelters for battered women. They help set up dental clinics. They do a lot of things. So when our students come down here, you will expect to see them be very involved in the community in projects. And our students have a totally student-run free health clinic in Columbia. It's called MedZoo, oddly enough, Z-O-U, not Z-O-O. And we have faculty volunteers there, but it's totally run by the students. Students from all 4 years run this thing, and it's really quite a remarkable thing. And you can say, well, you sound like you're pretty hard on the students. Maybe they're not too happy with how hard you are. Well, every year the Association of American Medical Colleges send a survey out, and all the students in the United States take this survey. And our current survey results are 98% of our students, graduating seniors, who are completely or totally satisfied or highly satisfied with the medical education program that we have. The other question that comes up, well, how do your alumni feel about having a clinical campus in Springfield? We've had some very detailed discussions with the governing board of our Alumni Association over the last year and a half, and everybody is for this program. They're excited about it, and like them, we can hardly wait for this thing to take root. So, thank you.
David Barb. I'm a family medicine physician from Mountain Grove, and I've been in practice there for about 30 years. Happens to be my hometown, and as you have heard, I attended University of Missouri Columbia for both my undergraduate, and then was fortunate enough to be accepted into the medical school there. And looking back on it, I think little did I know at that time how fortunate that relationship with MU really would be, not to me personally so much, but to the patients that I serve and to the residents of Southwest Missouri. It was at MU that I first had my exposure to MU's vision to turn out physicians for the state of Missouri. It was also there that I first really became aware of the critical and increasingly severe shortage of physicians, particularly in rural Missouri. And it was those two things that were cultivated over the 8 years that I was at MU that led both to my choice of specialty in family medicine as well as to my decision to go back to my hometown in Mountain Grove to practice. But I realized also that as dedicated as MU was to producing physicians for Missouri, they were not going to be able to do that without involvement of practicing physicians around the state. And so I made it a point to stay involved with University of Missouri Columbia School of Medicine with regard to their community-based educational programs. And I will tell you that they have been more aggressive and more progressive in community-based education than any other institution in this state that I'm aware of, and most around the country. And so I want to give you some examples of those types of activities that MU has been involved in for over a quarter of a century since I've been out of school. They are very proactive in encouraging their students to do rural medicine rotations rather than staying in Columbia for their family medicine rotation. They encourage them to get out in the community. So I've taken medical students in my practice in Mountain Grove periodically over the years. I've partnered with MU when they wanted to do a research project on sending second-year family medicine residents to a rural community to do their OB experience. And so I took second-year residents with me in my practice, in which I did OB, and they stayed with me for 2 months with the idea that we would see if those residents were more likely to incorporate OB into their practices and to go back and practice in a rural community. And guess what? It did. About 10 years ago, I became aware of a very progressive and novel program that Weldon started called the Rural Track Program. And that's a program in which third-year medical students spend fully half of their year outside the ivory tower of Columbia in a community-based practice. And there were a couple of those sites already up when I first became aware of the program. But then in talking with Weldon, Mercy, Cox, and MU partnered together and set up the first one of those in Southwest Missouri, west of Springfield in the communities of Aurora, Monette, Cassville, and Joplin. Since then, Mercy and MU have partnered and set up another rural track program in Lebanon. And between those two programs, over a dozen medical students a year spend over half of their third year in a community-based learning program. And I will tell you that the conversion of those medical students to physicians who practice in rural Missouri is much higher than in other training tracks or training programs. So those are some of the examples of how progressive MU has been. Knowing how many students from Southwest Missouri and Springfield attend MU already, but being aware of how many more students have simply not been able to attend medical school at MU because of the class size. MU's class is traditionally limited to about 96. It was almost more than I could have hoped for when a few years ago now, Weldon and I were conversing over dinner, and the topic of expanding MU's medical school size by a third and having those 30 to 35 additional students spend their third and fourth clinical years on a clinical campus here in Springfield just blew me away. That is really creative thinking and is perfectly in line with MU's entire history of cultivating students to make it more likely that they would choose a career in an outstate site in Missouri. So, the last couple of years then have the collaboration between Mercy, Cox, and MU have led us to be in this room tonight or today discussing the very likely reality that we can move this project forward and indeed have a clinical campus here in Springfield in the very near future. So it's a dream come true for someone like me who's been working with medical students and physicians in training in collaboration with MU for over 25 years. To think that we're on the verge of seeing this happen is just, it really is just too good to be true. And I challenge the groups that are involved here, both the health systems, the community groups, the chamber, to really see this through, to take hold of this opportunity, which is really a very unique opportunity to advance this type of program in a collaborative way in this community.
Good afternoon. I'm Steve Edwards, the president of Cox Health. Shortly after President Obama was elected and the health care reform debate began, the rest of the country began to realize what we knew in healthcare is that there are not enough physicians to serve our growing population. In 1 month's time that summer, I had calls from 4 different organizations that wanted to put a medical school in Southwest Missouri. And the reason why was we're one of the largest metropolitan areas in the country without a medical school. We're one of the fastest growing areas in the state. And they know that two of the 3 largest hospitals in the state are in Southwest Missouri, so the demand is there and growing. We began to talk to these different programs, and a couple of things came clear. You could start a medical school from scratch, and the estimates of that cost are not tens of millions of dollars, maybe not hundreds of millions of dollars, but could very well be upwards of $1 billion to start a program from scratch. A program with no history, no lineage, and no sense of quality about them yet. Missouri is blessed with a lot of medical school students. Per capita, with a very high number. Unfortunately, the number of public medical school students in Missouri is very low. Medical school students that are at the private schools tend to come from far away, and they tend to go back, leaving the rest of the state with very few graduates practicing in the state. What we know is that medical school students tend to practice where they grew up, where they went to school, or where their spouse is from. And so Southwest Missouri, either we need to get more spouses of medical school students, or we need to create a medical school down here. MU, the caliber of the program, we're convinced, the quality. Our medical staff is dominated with MU graduates. The curriculum has improved. The numbers are off the charts as we've seen that. And the cost to do it. At Southwest Missouri is, we're cautious, we're conservative fiscally, and it didn't make sense for the community to even contemplate bearing that kind of cost. This approach, it can be done so much more affordably, and you're bringing in a program that you know is high quality. that was all compelling to us. From a medical school perspective and education, in Southwest Missouri, we know we've got to often grow our own. Our own college has grown from 450 students, Cox College, which is mostly nursing allied health, to 850 students in 3 years. We believe to meet our growing need, it's got to be based on getting our own talent. We've got collaborations throughout this community like few communities have. Our colleges all work well together. OTC, Cox College, MSU, MU's coming down, Evangel, they all find ways to work together. I think this is another opportunity. We're very excited, but we also know it takes an investment from our community. There's philanthropic dollars that are going to be needed. There's state and federal funds that are needed. But for the amount of students that we can bring to our community, there's no more affordable way. And as Jim Anderson mentioned, the economic impact is pretty convincing. John Swope.
Thank you, Steve. I'm John Swope, President and CEO of Mercy Health Springfield Communities. You know, the first thing I want to acknowledge is really kind of echo one of the things that Steve said. I think we take for granted and so often don't realize how fortunate we are to live in a community with the kind of collaboration that goes on with organizations like MU, Cox Health, and Mercy, with a focus solely on improving the health in our communities. It doesn't happen a lot of places, and I think we too often forget that. Let me share some statistics with you just a little bit that emphasize the importance and the need for this program. On average, each family practice physician in the United States provides care for approximately 2,500 patients. However, with the growing number of older Americans and the potential of increased access to insurance coverage through health care reform, that number could drastically change. Estimates place the number of patients per physicians, if nothing else changes, at 1 to 10,000 in the not-too-distant future. As we all can appreciate, and no one better than Dr. Barb, or I see other physicians in the room, it's simply unrealistic. It's not sustainable. We have a population today that doesn't have adequate access. Without changes in being able to provide more practitioners, we simply won't be able to meet the needs. Healthcare providers have to look at new and innovative ways at meeting the growing demand for services. And the project we're talking about today is an important new development in specifically meeting that need. At Mercy, we view the delivery of healthcare as both local, regional, and virtual. Delivering the appropriate level of services closest to the patient's home, yet relying on regional hubs like Springfield to provide that tertiary care is going to be critical for the success of meeting the patient's needs into the future. The virtual access utilizes video and remote teleconferencing, and we're seeing that develop more and more all the time. We're already using many of these tools to provide the best care possible, but at the core is the physician. In Mercy Springfield region alone, we were fortunate to recruit almost 70 physicians last year, and this year we've already equaled that number and expect to exceed it. However, with all of that, we simply are not going to be able to recruit our way out of the challenges that we face moving forward. The demand for services is here. The Springfield region is a great place to practice medicine and a great place to raise a family, as we all know. And we in Mercy are confident that these medical students will see what's available here and they will want to stay here, which is most important. We're very pleased, as Steve said, we're very pleased in Mercy to be a part of this partnership with MU and with Cox, and we're so excited about the eventual reality of a medical school in the Springfield market. Thank you.
Thank Hal and Bob, David, and Steve and John for their comments this afternoon. As we all heard, a tremendous amount of planning has brought us to this point today. And certainly while there's more planning and work to be done, we're now ready to move to the next stage, which is taking action to make this clinical campus a reality. The clinical campus would require an investment in additional medical school faculty members and facilities. An approximately $30 million medical education building would need to be constructed in Columbia, and the school would require approximately $10 million in additional annual operating funding. Clinical campus supporters will coordinate the government relations and fundraising and other resources to secure the funding. This initiative is part of our Chamber's Economic Development Strategic Plan. This initiative is also part of our Chamber's state legislative priorities. And literally everyone can contribute to this effort. I know certainly everyone in this room is interested in improving health and education and the economy for Southwest Missouri and our entire state. So we have the opportunity to tell our elected officials, colleagues, and friends about our plans for the clinical campus. By working together, we can make this transformational project a reality and greatly enhance the quality of life for our communities. Literally, there's one person in this room, it's been alluded to, but he's the spark plug for this project, and that's the Associate Dean Weldon Webb. And we certainly appreciate all the work that Weldon has done up to this point and the work that will be required moving forward from this day. We thank you again for joining us this afternoon. This is truly a Good Friday. The participants will be available if you would like to talk with them more about our plans for creating a University of Missouri School of Medicine clinical campus in Springfield. The participants will also be available for interviews from the media if you would like to do individual interviews as well. And we would ask that you enjoy this special weekend of Passover and Easter. We're adjourned.